which is Lily's medical bag. We're just going to be going over the contents of it. And this is for caregivers, nurses at summer camp. And that way everybody's got it, so I don't have to go over it 100 times. Okay? So, in Lily's boo-boo bag, we have, let me bring this table over here. And I'm going to turn the camera lens around. We have Lily's boo-boo bag. In the center pocket, when the pocket is facing you, Lily, I really need you, honey. I need you. Bear with me, guys. I'm fumbling through it. Lily's supposed to be in here helping me. So this is Lily's hose and mask for the nebulizer. This is a note that I will introduce in a moment. Lily, I need you to please take out Nemo. So if Lily needs a breathing treatment, she knows how to set Nemo up. And we unwrap the cord. The cord gets wrapped around the tail and carefully tucked into the bag. Bear with me. I hate all the ums. I don't like that. All right. Now we're going to pretend that we're putting the medicine in it. We're not going to put it in it. In the sides of the bag, let me show you that first. These are not actual pockets, but this is where I tuck the medicine. This is a pocket, but this is where I tuck the medicine around the inner liner so that it's got somewhere safe to be and it's kept cool and dark. The package opens, you rip it from the top, starting where the blue line is, and you rip it open. The medicine has a little twist off top. Lily does know how to do it. You then, I'll go ahead and open this just so they can see it, but we're not going to open the medicine, okay?
Yeah.
So you rip it open, starting at the top where the blue and green line are. This is the twist off top. You twist it off. Please open your mask. And you're going to pour the medicine into this bottom part all the way. Make sure it's all in there. Don't tilt it after that, no matter what you do. This is going to go back in the bag. Okay, remember, this is the open one if you need it.
Yeah.
Then the mask goes like this. Do not tilt it. You'll spill the medicine. The hose then attaches, so it locks on just so you see it. I want to make sure I'm detailed. So it goes down and it locks on. After you turn it to the right, it locks in. This gets pushed nice and tight on here. Hold your mask, please. And the other end gets plugged in to Nemo's mouth. And then, of course, it would be plugged in. It's not plugged in. I don't want to have to plug it in. But it turns on here. You flip the switch up. And then when she finishes her treatment, it's usually 3 to 5 minutes. Then you switch it off. Again, take it apart. Make sure to take it apart. The hose gets carefully wrapped like this. This is how I do it because it's the best way to take care of it so that it doesn't get punctured or bent where it can break the tubing. And it goes back in the bag. This note I don't usually keep in there. That was kind of a last minute thing. So it goes back in the bag. The mask gets dried out. You want to make sure to wash the mask or sanitize it somehow with like a sanitizing wipe. Rinse it out, dry it off, make sure it's dry. And then it goes back in the Ziploc bag with the hose. And you zip it shut, get the air out of it. Again, this gets wrapped around the tail. And placed on his side back in the bag. If he's sitting up, he can't, you can't close the bag very well. So we just lay him down and underneath his bottom, nice and neat, we put the mask and hosing. So in the actual pocket in the bag is where I keep the note. And I'm going to introduce you to that now. This has her special medical alert card from the Hermansky-Pudlak Syndrome Network, the HPS network. This is in case she has a serious medical emergency and needs surgery or something that involves bleeding or being under anesthesia. This must be given to the ER doctor to scan and any specialists in a serious dire emergency, because there are special medical instructions that they need to follow to keep her safe, as she does have Hermansky-Pudlak syndrome, which can cause blood clotting issues. She hasn't had any from boo-boos or anything in a long time, which is great. However, and we haven't had to use this, thank God. However, this is for those critical emergencies where an ER doctor has to make a very quick decision on surgery or bone setting or something like that. The bandaging she has to use is not the typical, and it's very, 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 very important that the ER doctor and or surgeons have this and that they scan it. Okay, good. I'm glad you're here, Stephen. So that they can pull up the extremely critical special medical instructions. Okay. This is where I keep it. I have to print a new one because I've done the updated one, and obviously this one's tattered from last year. So I have a little pocket that I made in the back of this, okay, where I put the card strategically. So please don't let it fall out and disappear. This has all of her most important medical needs. I try to update it every year due to, and right now, of course, I do need to update it because she's had a lot of falls and chronic hiccups, which do have to do with the neurological glitch as well as the brain stem. And it's very important that she's given a breathing treatment in the event of chronic hiccups, very loud, very abrupt. And that means that she needs more oxygen to her brain and she needs rest because she's going to get real wobbly when that occurs as well. And she can be off balance. This is obviously her diagnoses, the most critical: respiratory distress, choking, bruising, bleeding, sunburn, and hives or rashes. Of course, again, I need to update that because of the chronic hiccups and the issues with that. So it's very important because it can cause extreme ataxia. She's had a lot of falls lately, and she is going to be going in to see her neurologist ASAP as soon as the car is done getting fixed. And I can set an appointment because she does need to have her brain scanned this year. These are her list of medications. It stays the same all the time. I do need an updated one. This is from last year. However, it is the same. This goes with the note, and it stays in the little pocket that I showed you. And I will show you now. Lily, I need you. I need your hands. I really need you to stay in the room right now. I need you to hold this like this. Hold Nemo like this for me so I can show them with the camera. All right? Okay. Now let me turn the camera lens around so I can show them. Okay, so this gets tucked neatly into the actual real pocket. Thank you, honey.
Yep.
There. And that gets zipped up. We lay Nemo back down, nice and neat. Now we have everything in order. And now I'll introduce you to the side pockets. Can you please unzip the right? When the boo-boo bag is facing you, on the right side are her bandaging. I do need to rebag them and refresh them. I'm sorry. Allergy. So this is for skin allergy. This is Afterbite. These are products that are safe for her. I also make sure to keep gloves. I keep PPD in there. I need to update it again because we haven't had to use these things since summertime when she was at summer camp. So that will be updated. I also usually keep a bottle of liquid Clozet allergy medicine for her that's dye-free. I don't keep it in there 24/7 because one, it'll sit there and go bad if it's not being used. Two, if this bag gets tilted, it's going to spill. Please do not let the bag get tilted. Please, I cannot afford to keep replacing medicines because they spill because someone is careless with the bag. The point to this bag is to keep it flat and level so that any liquid medicines will not spill. And on the left side, when the boo-boo bag is facing you in the left pocket, are her bandage materials. She cannot use Band-Aids. She cannot use any of the other tape. It must be this particular type of bandage tape. And please don't wrap it too tight. Let me just show you really quickly. I don't want to have to do this because it's very expensive, but I need to make sure that you're very well versed on this, guys. Thank you for being patient, and thank you for being amazing. So let's see an ankle, Lily. We're going to pretend that Lily's got a terrible boob right now. And let's pretend that this is an ice pack, okay? So, big emergency. She's got a boo-boo. Usually they're not bleeding very much anymore. She very rarely has an issue with the blood clotting. However, in the event that she does have trouble with blood clotting, you're going to put some bleed stop, not the whole thing. And please close it where it doesn't spill all the powder in the bag. And you're going to put, which I usually have in here, the coconut oil. And you're going to take the ice pack and you're going to put that gauze over that immediately. As soon as you put the bleed stop and you put the coconut oil, you're going to cleanse it, put the bleed stop, put the coconut oil, put the gauze, hold that in place for me, and then you're going to ice pack it. And all of those things together are going to cause that blood to clot if it's not willing to clot. If it's clotting, just at least cleanse it and put the arnica and put the gauze. Once you've got the bleeding to stop, if it's not willing to stop, you're going to put the arnica. Then you're going to bandage it. You're going to put her gauze there. If I can find the beginning of this.
You know?
No, I got it.
Okay.
You just hold that stuff in place. And you don't want to make this stuff too tight because it can really restrict. It can get very tight on its own because it's kind of like ace bandage material. Oh boy, this one's not going to cooperate. All right, we'll use this one. So it can get very tight very quickly if you're not careful. I hate to be able to show you what to do. So we're going to take a look at it, make sure it's going to go around. We want enough to go around where it's not going to be too tight. It can really cut off the blood flow. And hold on, let me make sure they can see what I'm doing. All right, and you can rest your leg on me. Let me make sure that the angle is good for them. I'm going to take this. You're going to wrap it and make sure that it's snug enough to hold, but not so tight that it cuts off circulation. It does stick to itself. Then you're going to cut it. You can even wrap it twice if you feel safer. Cut it and leave it, and it will be just fine. So that's wound care for Lily. Again, you're going to immediately wash it. I usually have Burt's Bees or Aveeno in the boo-boo bag, a little bottle of it. So again, you must keep it upright. You cannot let it get tilted at any time. It has to be kept level. That's why I bought the one that I did, so that it stays level at all times. If it's tilting at all, it's going to spill medicine that I can't keep affording to replace, and it's going to get all over everything. All right. I also have mending salve, which is also a good alternative, like the coconut oil, because I don't use Vaseline. It is, in fact, a derivative of gasoline, and I'm not putting gasoline on my child's body, especially an open wound. Amen?
Amen.
All right. So we worked really hard with specialists working on these particular things. So
Wait a
I'm
minute.
going to put that back in
For
there.
the people out there, what does Vaseline do for your injury?
Well, it's supposed to clot the blood, but Vaseline, again, is a compound made from gasoline.
Mm-hmm.
And so the bleed stop, the coconut oil, together with either the coconut oil or the mending salve, is a perfect compound because it's made from beeswax or the coconut oil, which is also going to help to sanitize it and disinfect, but also it's a good compound to clot the blood with the ice pack.
That's why you don't use Vaseline.
All right, and in this same pocket to the left, if the boo-boo bag is facing you, I also usually keep her dye-free acetaminophen. Please don't give her anything with dye in it. She cannot use the typical, she cannot use any kind of a spray, anything. Nothing that is, what is that called? Steven, comment, what is that called? The spray like aerosol. She can't use any aerosol, anything. No sunscreen that's not mineral based. I mix her sunscreen with a mineral based sunscreen with zinc oxide that would be applied to the areas that are exposed to the sun liberally. Please do not use any typical sunscreens on her, especially anything with aerosol, not anything for the boo-boos that's aerosol. It will trigger respiratory arrest that you can find her in a very dangerous situation if you do. She cannot tolerate the aerosol, which nobody should use anyway, but she really has serious distress from that, and it can really shut down her respiratory system. So that's the introduction to the boo-boo bag. There's Benadryl in there, the topical. Like I said, she does break out in hives and rashes sometimes randomly. This is specifically for summer camp. You guys know her, our nurses. We love you so much, Corinne, and everyone else. And our caregivers for Lily when I'm working. Thank you so much. And I hope that this helped. If there's anything more you need to ask, feel free to contact me or ask me face to face, and I'll be glad to show you. Have a blessed day. Thanks,
Blessed day.
Stephen.
Thanks. Hi, summer camp. I just feel like saying that.